Right now in the spotlight this week, following the sudden death of Hollywood legend Diane Keaton at the age of 79, has really shocked a lot of folks, fans worldwide, sparking this conversation. It's really important about a common but potentially deadly disease after Keaton died from bacterial pneumonia last week. We are joined right now by Novant's Onyinye Igbokwe, and she is going to help us understand this serious respiratory infection and its warning signs. Doctor, thank you for joining us this afternoon here on Live Impact News.
Yes. Thank you for having me.
So many people are surprised to learn that pneumonia could be fatal so quickly, right? Can you explain what bacterial pneumonia is and how it differs from other types of pneumonia or other respiratory diseases?
Exactly. So pneumonia can be a viral infection, just that kids get after a cold or adults get after a cold. It's basically fluid going down into the lungs and annoying and kind of blocking how your body breathes, right? So with most viruses, your body kind of mounts an immune response and can clear it and get it out of the way, right? But with bacterial pneumonia, we're dealing with a really bad bacteria called Streptococcus pneumoniae, right? And that pneumonia can get into your lungs and basically block off a lot of passages. It just plugs up those ducts that your body really needs to breathe. And it can lead to some really serious complications, especially if it leaves from the lungs and gets into your bloodstream or into your spinal fluid. So we're dealing with something that can not only cause pneumonia, but it can also cause meningitis. It can also cause sepsis. And that's when your body totally shuts down. So it's a pretty significant cause of illness, especially in our elderly population and in children less than 5 years old. Exactly.
Yeah, so it sounds like our more vulnerable populations. And according to reports,
Exactly.
Diane Keaton first saw a doctor September 24th, passing away October 11th. So that puts it just over 2 weeks later.
Yeah.
How rapidly can something like this then progress from treatable to life-threatening?
Yes. And that's the key is that, that's about a 2.5 week period from when she was ill to when she actually passed away. But I think the key in her case is to know that she also had some other chronic medical problems that they said the family said she'd been sick for a little while. And that's where the problem lies. In our elderly population, like you said, our vulnerable population, you unfortunately have more diseases, COPD, diabetes, people who've been smoking for a while. And then it makes the bacteria a little bit more susceptible, right? So your lungs are not able to mount a better response because you're already kind of tired or you have an illness that you are also treating. If she was on medication that made her more immunocompromised, even as simple as steroids or some, autoimmune diseases, then that brings down your body's ability to kind of respond to this bacteria because your body will send out these T helper cells to come in and fight the infection. But if it's busy doing other things as you age, then it's not able to mount a more sustainable effort to fight the bacteria. So we've seen people decompensate usually within a week after they get admitted and you're putting them on antibiotics, right? But sometimes they decompensate to the point where they have to be on a ventilator and then they're in the ICU and you're just kind of watching to see if the body will respond. So that's pretty typical of Streptococcus pneumoniae.
Yeah, all right, that makes sense. All right, so let's talk about some of the red flags or warning signs that folks might want to watch out for, and how do they determine, what can distinguish bacterial pneumonia from the common cold or the flu, and when shall they seek treatment?
Yes, that's a great question. And I think it's really important for you to first classify vulnerable or not vulnerable, right? We have some 65-year-olds who are out there running marathons and who are very active in their day to day. For those people, when they have a cold, yes, I expect it to clear in about a week to 10 days, right? But if after a few days you get fever on top of the illness that you already had, you get chills, you're not able to eat, they start vomiting, or just, are not progressing in a positive way, then that's definitely time to check in with your physician and say, hey, this is what started. Because the thing is, we all have streptococcus pneumonia kind of in our upper respiratory system. It's a matter of if it's invading, that's the issue. And so your body will send us those signals. You get a fever, you get chills, and this is after you've been sick for, a few days, and things should be getting better. But that second mount is your body trying to get the cells to kind of respond. And that's when to definitely seek help.
All right. So if someone is diagnosed early enough, you mentioned antibiotics. How effective are they then in stopping this infection?
Yes, antibiotics, and we're talking plain penicillin and augmentin medications that can really combat streptococcus pneumonia very well. But the thing is, we have a vaccine for pneumococcal pneumonia, and that has really made a great impact over this last, 50 years or so that it's been in our society, and brought down the incidence of kids getting hospitalized, adults getting hospitalized, and really reduce the incidence greater than 90%, right? So with the pneumococcal pneumonia vaccine, when you get it, it really reduces that incident. And then if you then combine that with the antibiotics, then streptococcus pneumonia is something we can actually, get rid of and cure. But it takes kind of like, a two-way street where we've got the vaccine in there, and then the antibiotics joins in to make the infection go away. So those are the two great options.
Yeah. Okay. And can you take the vaccine if you're already a little under the weather?
Well, if you're if you have pneumonia.
Well, not so much pneumonia, but say you're recovering from the common cold. I know there was something going around. People were coughing and stuff, so they might have some stuff lingering in their chest or sinuses. Are they okay to get the vaccine?
Oh, yes, you can get the vaccine as long as you don't have a fever, and it's just a common cold. And the vaccine now, we've got PCV20, and that's the most current one that has more serotypes, which are different types of the streptococcus pneumonia that can now cover these 20 additional strands, right? So we're covering you from 20 kind of highly effective pneumonia there. So that covers that. And then if you do get an infection, first, your body already has these helper cells that recognize that bacteria, and so it's making it go away. So then when we add the antibiotic on top of it, then it makes it a lot easier to cure it.
All right, very good. Any last message then to our viewers? We had a lot of great information here, Doctor.
Yeah, no, really to the viewers, I think the most important thing is to know that there's a vaccine for this, right? I think when we see somebody who's really well loved like Diane Keaton pass away, we say, oh my goodness, she looked great. What can I do to make sure this doesn't happen? And this vaccine has been out since 1970s, right? So it's nothing new. It's just something that is now available. And recently, last year, they brought down the requirement. Before was for people age 65 and older to get the pneumococcal vaccine, but now anybody from age 50 and up can get it. So it's a really great thing to go out and do that and stay up to date on that.
All right, very good. Dr. Igbokwe from Novant Health, appreciate your time this afternoon, and certainly I'll include myself in those Diane Keaton fans. Yeah, it was a bit of a shock and totally sad to hear that she passed away, and then certainly from pneumonia on top of that. It seems like, totally sad, but also shedding some light on this important conversation. So thank you.
Thank you.